In 2017, Partners for Cancer Care and Prevention developed Ámate, Cuida, Salud. This is a web-based tool created to bridge the gaps in providing health services for the early diagnosis of breast and cervical cancer. Cervical cancer and breast cancer are a worldwide priority, and countries in the region have different rates of mortality. For example, Colombia, a country with universal health care, reported 7.4 deaths per 100,000 inhabitants by cervical cancer in 2020. The United States reported 2.1 deaths per 100,000. The US and Colombia reported a large difference in the number of cervical cancer mortality cases in 2020. They present similar numbers for mortality by breast cancer. Colombia reported 13.1 deaths by breast cancer in 2020, and the United States reported 12.4 deaths per 100,000. However, we must not be naive to the fact that different populations, communities, and locations throughout the country have much different mortality rates by these two diseases. The health behaviors and how those behaviors take to practice, such as using screening services, are the objective of the Ámate app. Ámate is a web app that helps women to get an early diagnosis of breast and cervical cancer through assessing their knowledge on the basics of breast and cervical cancer and providing them the opportunity to have the screening services done by a local health provider. Ámate is able to be modified to work with different populations and different locations with different health needs. Ámate is available for all operating systems as a web-based app. No user downloads are required, which allows for a reduced cost of operation. Ámate was created as a way to overcome the barriers for screening. In Colombia, there is a low use of screening services, as only 23% of women ages 50 to 69 years old use breast screening services. This is due to poor or non-existent communication between HMOs and users, administrative barriers to scheduling screening appointments, and screening guidelines existing but being frequently unknown by women. The use of screening services is lower in women of Indigenous or African descent. While there is a much higher percentage of women in the United States that have had a mammogram within the last 2 years, there are still many barriers that stand between women and screening services. The mammogram is covered by health insurance, but many people are afraid of co-payments, and millions of women do not have health insurance in the United States. Barriers to screening include low income, low education level, and lack of access to care. The use of screening services is lower in women of Indigenous or African descent as well, and misinformation and myths are real barriers to access of screening services. Ámate is a tool that increases the use of screening services. It has 2 types of questions. The educational component provides easy to understand information related to screening, and the history assessment determines the user's need for screening. According to the user's answers, the app's algorithm provides a recommendation by mail or text, and a screening appointment can be made. The app is HIPAA compliant and secure. Ámate connects health providers, clinics, and HMOs to patients. It is available in multiple languages and can be optimized to face a community's specific challenges through utilizing a previous assessment to identify myths or concerns regarding screening in that specific community. The app can also be linked to other services, such as a patient navigation program. The initial results of implementation show that there was a 24% increase in the number of Pap smears received within the first 6 months of Ámate, and a 53% increase in the number of Pap smears within the first 12 months of Ámate. In summary, Ámate is available 24/7 and focused on the use of services. It facilitates access to screening services and measures individual risk. It is available in multiple languages, HIPAA compliant, and the screening recommendations are provided to the users and healthcare institutions involved. For more information, please visit us at www.pfccap.org.